Good evening, everyone. Good evening. Good evening. Welcome to Ageless Intimacy with Dr. Mia and Joseph. I am Joseph, Bella Men's Health and Wellness Coach, and this is
Dr. Mia, your B3 specialist and board certified gynecologist at Bella Wellness Center, where we offer gynecology to women and adolescents, as well as weight management, hormone pellet therapy, total wellness solutions, laser hair removal, and intimacy services for both men and women. Our goal is to help you live well, age well, and experience everlasting intimacy. So, Joseph, we got some great stuff going on. It is June, so it's Father's Day month. And a lot of times our fathers kind of get left out and get the end of the stick. A lot of times they do. Not here, because you already got your Father's Day gift, and it was amazing. You chose it, so we won't tell everybody what it is because it'll sound lame, but it was what you wanted, right?
It's what I allowed you to get me.
Yes, it's what you asked for, and that's what I got you. So we want to make sure that we focus on men's health, the importance of prostate screening, and making sure that y'all are doing the things that you need to do for everlasting intimacy. And we do know that prostate health goes completely in line with intimacy. So just a few things. Make sure you're getting your screenings at least starting at the age of 40. The good news is that now the screening is usually going to be mostly from lab tests. And if those lab tests are normal, you tend to not have to have the digital or rectal exam as frequently. So still go get your screenings. If there's something going on with the actual PSA or that lab number, then they know you need further workup, which may require an exam as well as other imaging and sometimes a biopsy. So just make sure you're doing that, because prostate cancer is very prevalent, and it's something that if we catch it early, we can definitely cure and get rid of. And the earlier we catch it, the less likely we are to have major treatments like the removal of the prostate. Anything else you want to say about that, Joseph? And I'm sure you've had to go to the doctor, and you still have had at least one digital or rectal exam, and that's helping to prevent prostate cancer. So do you have anything you should say to the men, or any encouraging words to make sure we're all doing our part to, for early cancer detection?
Yeah. So, if you're over 45 now?
40
now, you should be having your prostate exam. If your doctor's not telling you that, then you probably should switch doctors. That's pretty simple.
And when he says exam, remember, a lot of times that can be just a blood exam.
Yeah, it's just a blood, but they should be asking you to get that done. Or they should be saying, we're going to get your blood or send you to the lab so we can get your prostate checked because you're over 40. I get mine done every annual. So, it's pretty much a regular. But we were talking about prostate, men's health, and also andropause, as well as this is Men's Mental Health Month as well. So very important that we're taking care of our mental health as well as our prostates. So let's make sure we take care of our mental health. But we're talking about prostate right now. I think when it comes to prostate and erectile dissatisfaction, some men believe that when you have prostate cancer, you're pretty much done with any sexual satisfaction. And that's not necessarily true. And it's not 100% false either, though, but it's not necessarily true. I don't want anybody to think that because you have prostate cancer, which is very curable when it's detected early, that your sexual function is over. That is not necessarily true. There are some treatments that are recommended, but are more harmful in erectile dissatisfaction than others when it comes to prostate. But you should explore all treatments if you did have a prostate exam and it came up positive. The other thing is, once you go through it, as soon as you go through your treatments and you get the clear from the doc, you should be really working on your erectile dissatisfaction function. Now, some men say it came right back, but said it is taking time. And excuse me. and it's all about blood flow. And certain treatments block the blood flow to the genital area. So we want to make sure that you start treating those areas, because it can be reversed. It can be reversed. Now, it's not 100%. I'm going to be 100% honest with you. It's not 100% that it will be reversed, but you can start having good erections after prostate treatments. So,
and then making sure you're also doing those other wellness things. So, making sure you're getting your other screenings, making sure you're controlling blood pressure, making sure you're controlling cholesterol. If you have diabetes, eating the right foods and keeping that hemoglobin A1C down, because again, it all goes back to blood flow. With a lot of the treatment options for prostate cancer, it definitely will affect blood flow.
Right.
Those can include radiation. Those can include surgeries. So those things will negatively affect it. However, once the cancer is treated, there are, like Joseph said, some great treatment options out there. So we want to make sure that everybody knows about the webinar that we are having on Thursday. It'll be me and Joseph, and we'll be talking about andropause and menopause and all the different intimacy solutions for both men and women. Because, Bella, our goal is to help you live well, age well, and experience everlasting intimacy. So we're actually doing this next webinar for the men. We want the women, we want the ageless bells to bring the ageless bows, and we want to make this an opportunity for us to speak to both men and women about how to live your best life, live a life of total wellness through wellness, which includes hormone balance, weight management, and intimacy solutions. So remember, go get your screenings, get your annual exams, get your prostate checked. If your numbers are off, go have the exam and the workup that's recommended for you. If you are diagnosed with prostate cancer, it's most definitely not the end of the world. More men die with prostate cancer than from prostate cancer. So again, there are so many treatment options out there that are minimally invasive, non-invasive. Some people will need the more invasive options. However, after treatment, there are some things that you can do to improve your intimacy, to improve your wellness, and decrease the chance of a recurrence of prostate cancer, but also improve your sexual function even after prostate cancer. So make sure y'all join us on this coming Thursday at 7 p.m. Central Standard Time. Joseph will be talking to the men. I'll be talking to the women. We'll be talking as couples. And so we want everybody to join us so that we can give y'all the lowdown nitty gritty on how to live a life of wellness, even while you are in this mid portion of life where your hormones are changing, you're transitioning into menopause and andropause and through menopause and andropause. And we're going to talk about all of the different things that you can experience associated with that. And Joseph, so I just left this great wifeology conference. Shout out to Dr. Cree. It was amazing. We had probably about 50 wives there, or if not more. And we talked about, being a good wife, self-care. We talked a lot about intimacy, which is a conversation we don't have a lot with women. But in that conversation, a lot came up with just having the communication. Like we all know as women that we go through menopause. What is it that you would say to men about some of the changes that they experience that we're going to talk in more detail about on Thursday, but why the men should actually attend and learn a lot about, andropause and total wellness for men?
Well, I would say this is something that we don't talk about because we're not educated on it at all. So I think the important reason, the one reason you should be there is so you are educated and recognize some of the life changes that you're going through. I'm not going to say symptoms, but some of the life changes you're going through and how they affect you when it comes to your hormones and your sexuality too. So I would most definitely say that this is something we're not educated on. We know women have a menopause, but a lot of men don't even know what andropause is. So most definitely tune in so you can learn what that is, and also learn, recognize what you're going through if you're in this. And I'm not going to put an age to it because people go through it at different ages.
Right. And so much earlier now based on how our food is and, our health and the changes that's just going on in our environment.
Yeah. So I wouldn't even put an age on it. So, tune in because, it's just being educated about what's going on and also being in tune with what's going on with yourself.
Mm-hmm. So join us on Wednesday at 7 p.m. Central Standard Time. We'll add the link so you can simply click the link. You can always go to our website, mebellawellness.com. Click on the link, register for free. Have a little date, a little in-home date. Have your wine and your drinks ready because we're going to talk about some real issues that affect women and men in their late 30s all the way throughout the rest of their lives, and the things that we can all do to live this life of wellness and be able to experience everlasting intimacy. So I hope you'll join us. I hope you'll register, share this with your friends, because it's going to be great information and we're going to be available to answer so many questions. So thank y'all for joining in. Hope y'all have a wonderful week. Go live well, age well, and experience everlasting intimacy. It's Dr. Mia and Joseph. Bye. See y'all Thursday.